Welcome, welcome. Hi, everyone. Welcome to our live. Welcome to our panel. Okay, so today, thank you, first of all, thank you so much for joining us, those who are joining us. Before I jump into it, I'm just gonna give people a few minutes to join in, to click on those links and hop onto the conversation and be part of it. Before I jump into it, I'm just gonna give people a few minutes to join in. Okay, okay, so today, this is a very special live. This is gonna answer a lot of questions that we often get in our inbox. It's going to address a lot of things. I personally am super excited to be hosting this live. We are talking today about the Nutrition Network's new facilitation group training that is up and coming. I want to say up and coming because it's really exciting. It's brand new and I feel it's so fresh, and I'm a little too excited to like contain myself, so bear with me, guys. With me, I have Jayne Bullen, who is our COO and one of EPSA was the brainchild for in 2015. Yes, that's when EPSA was founded with Dr. Hasina Kaji, Jane, and Iodia was also part of it, and the Knox Foundation as well. And they saw the need of nutritional education in communities, and people were often asking, we want to eat healthy, we want to eat better to live better, but how do we go on about it? What do we do? So they came up with this brilliant idea, and here we are now, 5 years later, yes, 7 years later, we've got this brilliant 7, hey Jayne?
I can't believe it. It feels like 2 years, but I can't believe it's actually 7 years. That's quite an important number.
Yes, we are 7 years old. We are big kids. We are growing, and the need is so much. But I'm going to give it to Jayne to tell you guys about the exciting training that Nutrition Network has got, and we will dive right into it.
Okay, thank you. So I'm going to step back one step and talk about where this all began. And I wanted to share with you actually one of my favorite quotes in the whole world. It's by someone called Amma. And it says, "Don't be dispelled by your incapacity to dispel your darkness and the darkness from the world. Light your candle and step forward." And that's such an important quote for me when I think about Eat Better South Africa, because that's how it began. It was a group of us that felt devastated at the state of our nation and the state of the health in our country. And we see it every day. You know, we see people that are just grappling with terrible, terrible lifestyle diseases in our local communities. And we felt desperate to do something. And we knew what would work. We had an understanding of what would work. So we tried it. We just lit our candle in one small community, which was Ocean View. And it's taken off from there. So here we are today with an amazing, amazing team that's growing and that's evolving. So that's how it started. And of course, what this training is about is saying, okay, well, we've got this formula that we know works in a South African context. We've run a number of pilots now. I've lost count of how many. We've had 2 formal assessments. In a number of countries. We've shared what we're doing here, and the world has listened and has come and said, please share it with us. We need this. So we've had people from Indonesia, from Mexico, from actually in the USA itself, from Canada, from actually probably almost every country in the world that I can think of now, various African countries coming to us and saying, we need your help. We need to grow the work that we're doing with our low carbohydrate awareness. How can you input? How can we support you? So particularly not only people from local communities in developing countries, it's been people from like running doctors' practices in Canada and things like that. So from our Nutrition Network community, from a global perspective, we decided that it was the time to build a training that would support anyone to be able to become a group coach and to adapt their practice in a way that would support groups in any context. So that's what this is about. And I think it's an amazing, amazing training for anyone to do, because it really it bridges the hard science and the heart of the work that we do and brings it together into a group setting.
Thank you so much, Jayne. And there we have it, guys. The training, yes, like I said, I'm probably going to be one of the first few to do it because it's exciting when you want to do good in your community, when you care about your community health, wherever you are in the world. This is the answer. And I feel like it's such an amazing aspect of community health, whether you want to implement it on the government level or whether you want to take it to school or to a church or just something you want to learn for your family. This is the answer, and it's such a brilliant one because it's made in such a way that it's an inclusive education. When we talk often in education sector, when we say we talk about how we can make education inclusive, how we can make service inclusive. This, by definition, for me, this is it. I'm going to give it to Jana, who's going to tell us a little bit more about who can do the course and who's the course is specifically made for. Jana, over to you.
Thank you, Yvette, and thanks, Jayne. I'm also very excited to see this training being put out there. I think it's very much needed. And I've been part of the EPIDA South Africa team, I think, for the past, almost 4 years. Wow, time flies. And I've been honored and privileged to be part of our programs and to be able to see firsthand just how impactful it is and how it really changes people's lives. And over the years, things has just started to change. And like Jayne mentioned, we really saw a need to turn this into training so more people can have access to this. And I think primarily there's going to be two types of people that I think will really benefit from this training. And it is anyone interested in uplifting and empowering their communities, whether it's the poorer communities, whether it's a community at your school, at your church, at your workplace even. This training will be able to give you all the tools you need to go and run these programs. And then the other type of person will be for the person that might want to monetize this. They might want to incorporate this into their personal coaching package, as we provide all the tools and all the facilitator skills, and of course the backstory, which is so beautiful about EPIDA South Africa and how all of this came to be. I think you're
there we go.
Yes.
There we go. Yes. Thank you so much, Jana. I feel a personal connection to the course because it's something that whether you want to learn on your cell phone, whether you want to learn on a laptop, or you want to go to a community-based library and you want to do the course on your own pace, that's how accommodating the course has been. It's made with I want to say everyday person is an everyday person. It's made for everyone. Doesn't matter where you learn or how you want to do it, you will do it at your own part. I'm going to ask Jayne next now to tell us a little bit more on the specific of the course itself, not in a way that how people can access the course now. How do you go on about it? Let's say we are talking now and I see a lot of comments and I see people, the excitement, I'm feeling it, guys. From where you are to my table here, I am feeling the excitement and I'm loving it. And I'm going to hand over to Jayne to tell us how you can access the course, how you can go on about enrolling, and how you can reach us on how to connect into the course.
Okay, awesome. So this is a training that's very similar to our other Nutrition Network trainings in its format. So it's e-learning, it's going to be online. It's got a toolbox of things that you'll be able to use after the training, which includes you'll be trained on how to do our actual sugar demo. You'll be given a set of resources to use for your group coaching practice. So everything from infographics that you might need, posters, presentations and guides, food diary maps, PDFs and different formats that we've built over time for your weekly meetings, measurement tracker, intervention checklist, BMI tracker, coaching tools, and a typical set of FAQs that we've built up over the years through the Eat Better program. So what's happened over the years is that we've tested and tweaked and perfected this program, and we know what works. So we've built something that's simple in essence and incredibly effective at supporting the candidates that do the program for it to work. and for to incredibly improve their health over those 6 weeks. It's by design that it's 6 weeks and not 10, 8, 12, 30. So all those kinds of questions are covered in the content. And then the actual story of the way that the training's structured is that Prof. Noakes and myself share the story of the Eat Better South Africa journey. So we talk about where it came from and why we began it and what our experiences of it have been and our sort of big memories, some really incredible memories and people that we've met along the way who have changed their lives and in doing so ours. And then we go into a slightly more formal scientific section of the training, which is where we look at sort of how to actually treat a low carbohydrate plate. Tamsin Murphy, our amazing dietitian, who's been involved in the trainings from the get-go, shares her story of how to approach things and how we do things within Eat Better South Africa that applies to local communities and how we customize it. So it's not specifically, this training is not for the South African context, it's for anywhere. So if you're sitting in Nigeria and you're looking at how to structure and change a plate for your community, we're going to give you the tools to be able to do that and how to customize it to any, or I would like to say any budget, but almost any budget. So the lowest we've ever gone was in a community in Villiersdorp, which is a little town about 2.5 hours from Cape Town in South Africa. And we brought the budget down to 13 Rand a day per person, which is, look, that's under $1, isn't it? I'm trying to think of what the dollar-rand exchange rate is. It's probably about 80 US cents a day. And that was a program that was run by a local nurse. And that was one of our more successful interventions. So what we've shown through Eat Better South Africa is that you don't have to give people necessarily more money or subsidize their food budgets to get them to eat better and to change their lives, to reverse disease. It can be done with what they're living on at the moment. And that's always been core to the way that we do things, is we look at what are they eating, what are they spending on food, and what can your community get nearby? So a big problem that we have in South Africa, of course, is cold chain management in local communities and in non-formal, so informal settlements. People don't necessarily have access to refrigeration and the same kinds of grocery products that you see in the first world. So we look at other things. You know, we look at ways that they can eat different healthy foods that are available nearby in markets, in shops, in spaza shops, and whatever else there is in your community. So we'll walk you through that. And then we look at Dr. Hasina Kiji gives an amazing talk on the actual doctor's role and the medical role within the actual intervention. And that's a really, really important subtlety, is how to, as a doctor, be involved in a program like this without letting it be a full medical intervention. Or, you know, we try to keep it. I always think of when I was a little kid, I think I was under 10. One of my siblings was overweight and my mom marched her and with her, all of us off to weigh less every week for, I think, a year. Like, we would go and sit in this horrible little old church hall, and there was a lady who knew nothing about science that was like motivating everyone. And that is how around the world weight loss models and weight loss support has always worked. It hasn't necessarily been a medical story. And when we look at, you know, personal trainers, a lot of the people that do our trainings in Nutrition Network are personal trainers, coaches, non-medical professionals that are having huge impacts on people's lives. So it sits in that category, but we look at it from with medical support, because we're working with people with chronic disease. So what Hasina shares is what's so important is a physician's perspective on how to find that balance and who to look out for, how to treat them, how to support and find a local physician, all of those details. And then there's Georgina, who's one of our lead researchers. She talks about the actual study that was done on Eat Better South Africa, where we looked at a mixed method evaluation of the program. And its sustainability. And then that's only the first section. There's a separate module on the training, which is entirely run by a master coach, Amanda Stradham. I actually did her coaching certification a few years ago, and it changed my life. And she's an amazing, amazing facilitator around groups. So the second half of the training is actually Amanda taking you through coaching skills. And those are coaching skills that apply to a group setting. So if you're a coach or somebody that's leading groups or seeing patients at the moment and you're interested in going bigger, so taking on, you know, running groups. So our typical Eat Better groups are anything from 12 to 80 to 100 people. So it's looking at how you're going to scale up the knowledge that you're sharing, how to depersonalize it, but keep it tight and scientific, how to support people through that. So she takes us through an amazing set of topics, including, how to be a facilitator, how to build relationships, how to listen, how to lead groups, how to approach things from different worldviews and include diversity and culture, as well as groupthink and expectation. And then also there's a section that's around the support of how to actually support people through e-learning. So that's through WhatsApp and through the different programs and tools that we use. COVID and today's world, that's quite an important section. And the third module I want Jana to talk about, because she presents it.
Oh, thank you, Jayne. You were on a roll there. I did not expect this. But yes, in the third module, which I present, which I really enjoyed doing, I talk more about the actual practicalities of this program. So what does it mean when we do the Eat Better South Africa program? What does it look like? What is the first session about, the second session? How do we put it all together? And how do we also communicate the information to the participants? Because I think that is really key, to know how to talk to the participants, how to engage and how to convey this information, which often might be very difficult to understand, or it might be very, very scientific. So how do we make it accessible to the community members? And with this, of course, comes, like Jayne mentioned, a lot of the tools in the toolbox, which is very exciting. So at the end of the day, when you've done this training, you will have everything you need to go out and run a group coaching program. And I think one of the aspects that's really stand out for me, and something that we had to adapt to, and Jayne, you touched on it now, is how do you do this within like the pandemic where we're at in, or how do you manage and how you do it when you have to revert and go back, oh wait, we have to do things a bit differently now, we cannot meet. What do we do? How do we make use of the resources that we have? And how do we take into consideration the resources of the community as well, which is a very important aspect to make the coach program a success. So personally, I'm very excited. I know it's been a big dream of Eat Better South Africa, the NERCS Foundation and the Nutrition Network to be able to equip people globally to run these Eat Better South Africa programs, because that is how we are going to change the health of the world, one community at a time.
Thank you so much, ladies. It's super informative. I am loving what I'm hearing, because as a new person into the EBSA family, into the NTF family, it's been quite a learning journey, because I remember a while back on Dr. Asina's, as I was doing my courses, the Nutrition Network is courses, and there's a part where Dr. Asina talked about the importance of connecting with your audience, the importance of talking, relating to what you're teaching. So this is brilliant, because it does not only empower you, but you become part of this wonderful family. Nutrition Network has got this amazing platform, community platform, where whether you have a question, you wake up in the middle of the night, you're like, oh my God, I just remember, I'm not so certain about what I told that patient. You have a community whose strength you can draw from. It is such an amazing, it's almost like, you know, when we say raising a child takes a village, I feel like this really applies when it comes to communities' health. It really takes a village. And that is what Nutrition Network is done here. You become part of this wonderful family. You meet new people. You get to connect with like-minded individuals. Meanwhile, making a huge difference in your community. And that, for me, has been what really matters when you work in a community. You don't know them, or you don't know the community, or you've never really, you want to do good in your community, but you've never really opened yourself that much to all of that. And now all of a sudden, here you are, you've got the equipment, you've got an entire village behind you. I'm saying a village because it really becomes this, we are a good family that looks out for each other, who supports each other, and you've got a really support system that will give you what you need so that you can go out there with full confidence to apply the learning that you are drawing from this community. And that, for me, has been a really big positive impact, because whether we get a call from Masipumelele last year, as EBSA, we got a request to go into Masipumelele, which is a township in Hot Bay in the Western Cape. And then we get there, these amazing, well-behaved teenagers, they're ready to learn. And then at first I was like, oh my word, how am I going to connect with them? I don't have a teenager yet. Give me a group of young moms and then I'm home. But here it was about a group of teens and didn't know how to relate to them. But lucky for me, I had catered the content based on my research of the community, the knowledge I have of the community, and that automatically became the link between myself and the community. The bridge was gapped. We went into it, we learned, we shared, and at the end of the day, it was such a fun experience for all of us in that room on that day. And that is why I'm like super excited that everyone get to have access to that. And now, with all that said, guys, we have covered how you can get to the link, how you can enroll in the training, what the training is about, why it's so important, because it is super important. Jana, I'm gonna put you on the podium again to tell us. So guys, if you have enrolled in the course, you have done the course, you were super excited. What's next? What happened after you finished the course?
So after you finish the course, you can contact Eat Better South Africa if you feel strongly you want to go out, you want to change communities, you want to empower people. You contact Eat Better South Africa, and I'll ask the media team also, we can pop the email address there in the comment section. It's info@eatbetter.org.za, and you can let us know. We would love to support you. We'd love to get involved in your communities, no matter where you are based in the world. And then, of course, on the other hand of things, is if you want to take this course and you want to implement it in your practice, in your coaching practice, even medical doctors who would like to learn more about communication and how to talk to their patients, how do they communicate all these information, this is really valuable to them. That is really the next steps you can take after completing the course. And then, of course, there's all the other nutrition networks trainings, which you can then again, just if you are interested in this particular topic, you're interested, go have a look at their trainings, see if there's anything that stands out for you, and maybe pursue that as well.
So I want to actually respond quickly as well to what you were saying about the community, Yvette, because this is such a big thing. Is the biggest feedback that we've had since we created the Nutrition Network is that people have felt like they've got a place to land, and that it's very, very lonely out there wherever they are in the world. So, whether you're in Vietnam or in Dubai running a small practice, doctors, particularly the medical guys, feel quite lonely in what they're doing. There isn't enough support in communities. So what this offers is a place to land, like a home space where there's kind, compassionate support, positive energy, and other people that have been on this unique path. It's not the path for everyone. It's a path of like definite bravery and being a pioneer wherever you are in the world. And that's quite scary and lonely. So that's an important part of this, is because we're taking people that are working individually and feeling isolated and bringing them into a community and saying, take your work into the community and broaden it and make it bigger, which is the hero's journey, of course. It's like, how can I use my time better to impact more people positively in the world in this lifetime, and use the chances and the knowledge that I've got to do that. And that's, of course, group coaching. It has to be that way. You have to share your knowledge with more than just one patient an hour, or in 10 minutes in some cases. For some of our GPs, that's how much time they have. How do you do this? Well, this is an opportunity to really expand massively the ripple effect that you have on your community and on the world.
Thank you, Jayne. Yes, I echo all of that. I feel like this is an answer. We often get on our comments below, how do I become a community coach? People have passion. People want to eat healthy. You have, especially where culture is very, very immersed in communities, there's a lot of myth to be unpacked. There's a lot of things, and then people want to do that change. They want to be the ones who pioneer those positive changes. There's just never been enough support or enough communities that will accommodate that, and we've got that now. And I feel like we've laid a good foundation. We are ready to impact the changes, and I feel really positive about it. I am loving the response we're getting, guys. It is amazing, and I'm loving it. we're doing important work, and EBS's work really has changed so many lives, not just through our existing community coaches. If you've been following our social media pages, you would have read our Women Crush Wednesday, where we share a little bit of stories about our community coaches and how their journey. And every time, even though I've read it before, even though I've spoken to them about it, often I'm just so amazed at how far the EBSA program has taken the individuals and how far it has strengthened not just them, their family, those around them. It's really making the impact, and I am grateful that we have the tools and we have the support system that we need. If you're new, guys, please follow us on our social media to learn more, or where we are, or which community we are in. Or if you want to become a community coach, here's the tools now. We've just unpacked it. Reach out to us, like Jana say, info@itsbetter.org.za. Reach out to us, whether you DM us, we always answer. Follow us, or if you are a corporate individual, or you have a business, because we are so accommodative that our one-day workshop can also be used as a team building interactive activity. We've got content from your early childhood phase children, for adolescent to young teens to growing adult to adult. We've got content that cover all that, so nobody's ever feeling really left out. So if you want to invite us to come and do the talk, to whether it's your business, at your church, or your community, please do reach out to us. We do them virtually, we do them in person, of course, while adhering to COVID regulations, because that has become a really part of our reality. Reach out to us, guys. Thank you, ladies. Jayne, thank you so much for making the time. Jana, thank you so much for bringing your wisdom to the platform. I really appreciated the time. The team at Nutrition Network, thank you guys for this amazing life-changing course that will be up very soon. That's it from me. Ladies, do you got any last words to share with our listeners before we go?
I wanted to say that this is a training that we've built in partnership with Eat Better South Africa, and we've made sure that the majority of the proceeds goes to Eat Better South Africa. But that being said, it is a paid-for training. And if you can't afford to do the training, please write to us. So what we'd like to do is open up a scholarship program for anyone that is working in local community, or that doesn't have the funding, but that wants to implement this into their practice or into their community. Please write to us. Don't let price be a problem. Come to us, work with us, find ways to be a part of this training. It's really something that's so important for us that we make it as accessible to as many as possible. And if you can, of course, if you can pay, please do, and know that a lot of the large bulk of that will go towards Eat Better South Africa, and hopefully training others and giving back to others. And also, if you'd like to sponsor someone to do it, that's another way you can do it.
Thank you, Jayne. Oh, that sounds, yes, that's good news. Yay. I feel like we should have all these the microphone and say, good news, you can sponsor someone to do the coach. Yes, community coach mentors. I'm looking at you and I'm saying, pick that young mentee or that lady that you see the passion is there but can't afford the cost. Please do sponsor someone or write to us and we will work with you. Thank you so much, ladies. And that's it from us for the day. It's been fun. Thank you. Goodbye, everyone.
It's lovely.
Bye, everyone.
Bye.
Bye, everyone.